Good morning. Welcome to the NYU Returns webinar on returning to work for staff and administrators. Please note that closed captioning is available for this session. My name is Delmi Lendoff, and I'm the Associate Dean for Student Affairs at the Steinhardt School of Culture, Education, and Human Development. With me today for this session are Sabrina Ellis, Vice President of Human Resources, Matthew Driscoll, Assistant Vice President for Employee Relations, Grace Kosashov-Protos, Assistant Vice President for, Executive Director for the NYU Work-Life Office, Carlos Ciatoli, Associate Vice President for NYU Student Health and Executive Director of the Student Health Center, and Jack Briggs, Vice President of Global Resiliency and Security. I want to thank all of our presenters for joining us and all of you for joining in for this session today. I'm going to begin by asking each of our presenters to begin by sharing a little bit about their offices and introducing themselves. Sabrina will get us started.
I was on mute. Hi, everyone. This is Sabrina Ellis. I am the Vice President for University Human Resources, and we are here to provide what I hope will be helpful information on a host of questions related to Restart and how that impacts employees and any other considerations or questions that may come up related to that.
Good morning. My name is Matt Driscoll. I'm part of the Human Resources team. I'm the Assistant Vice President for Employee Relations. My team is responsible for communicating and dealing with the unions and any employment issues that come through HR. Thanks for having me today.
Hi, good morning, everyone. I'm Grace Kosachov-Protos. I'm the Executive Director of Work-Life. Thank you for inviting Work-Life to participate in this NYU Returns webinar. Our office provides a variety of support in what we call your work-life needs, everything from self-care to caregiving generally. That could include caregiving children or adults or adult older loved ones. We help you determine options for your care needs, and we create programs and events. And I just want to say we've been listening to a lot of what you've been saying and trying to think about ways that we can be supportive, and I'll share more a little bit later.
Good morning, everyone. Carlos Ciatoli, Associate Vice President for Student Health and Executive Director of the Student Health Center. But for this morning's webinar, my role is really as lead of the university's COVID-19 prevention and response team, which will really serve in the broad public health role for the entire university, faculty, staff, and students.
Good morning, everybody. My name is Jack Briggs. I work in public safety in my day job, but since the end of December, I've been supporting the university, working with the NYU Returns Steering Committee, helping to orchestrate the planning for and execution of our return for the fall. So we'll go from there.
Thank you all. So I'd like to remind our viewers that we'll be starting off with a presentation followed by some questions that were submitted in advance. We will also be taking questions from the audience, so you could use the Q&A. So if you have questions, again, click the Q&A button on your screen and submit them. We'd like to remind you that we will only be answering questions about returning to work for staff and administrators today, and that you should check the NYU Returns site for things like videos of past webinars and answers to questions that you may have. So we're going to go ahead and get started. We are going to begin with a presentation on returning to work by Jack Briggs.
Good morning again. And thank you for the opportunity to sort of run through a little bit of what we've been working on for the last almost now 8 months to try to get ourselves prepared for what's going to happen in September. This has been a group of folks that have been dedicated to this from all across the university, and I hope when you see in the slides you realize the depth of what we've been doing. but really it's more to sort of set the stage so we can help answer some of your specific questions. Next slide, please, Tom. So in the different ways that we try to describe this, I think one of the best ways is to start with what external guidance we've been trying to work with. On my screen and yours, I hope, I'll start with the right-hand side, which is the state of New York. So from the governor's office and the health professionals here in the state, from the beginning, we've been getting guidance. Now that guidance initially prompted us to have to switch from in-person to remote learning at the university at a very quick pace through the month of March, which then settled into what we did for the spring. But starting in March, we started to look at what we would be doing for the fall semester. And we have been working with the state to get guidance. The state has 4 phases that they have different regions progress through. Most of the state is in full phase 4. I will tell you that New York City itself is in phase 4, but there are some limitations to what that is for higher education. Specifically, we have a limit on what we call congregate instruction. But that will, we believe, be lifted for the beginning of the semester. And in fact, I'll speak about a plan that we have submitted that helps get us along that road. In the middle is the CDC. Of course, the CDC has a number of functions, guidance, and best practices. We have been using those from the beginning to help us form what we're going to do for our plans. And then the third one, which is on your left, is the Commission of Independent Colleges and Universities in New York, or CICU. This is a group of the universities and colleges in the state who, back in March, we started talking to each other about what the fall would look like. And as you can imagine, there are a variety of different versions of that. If you think about upstate schools that are very small, which have a closed campus, versus NYU with its large, expansive campus inside an urban environment. So together, we looked at what would the best practices be and what flexibility we would need from the state. And then we went back to the governor's office with a recommendation early in May that has then led to what the state has sort of come back and explained to us about what the guidance would be. Next slide. I mentioned that the state has required a plan from each university. Yesterday, we submitted our plan. President Hamilton attested to the plan that we have. It will now be published so that people can see it. It has 4 sections to it with detail. Let me tell you that as you read it, some of you will be asking, where's the more detail on the particular issues? I would encourage you to read the plan and then also go to the NYuReturns website, because that's the website that's going to give us specific details based on your role at the university, what applies to you and how you can do that. And it answers a variety of questions. But you can see in the plan that we had to submit, it covers how we're reopening, what we're going to do to monitor, how we're complying with the guidance, our plans in case something happens. I can just tell you that since we went to remote learning in the spring, we have had to monitor students who remained in the dorms and respond to them if they were symptomatic, and then do contact tracing. So we've had some of these processes in place since the beginning, but we needed to write them down. And so they're now in this for the state. So we put them in this plan. The last is shutdown. I don't really like to use the word shutdown. It's a word that they wanted us to use because we never really shut down. Like I said, we continued to teach, we continued to have students in our dorms. So we continued at a smaller scale. Now what we're going to do as we reopen is we're going to expand the size of what we're doing. And we believe we've got a plan to do that. Next slide. So what are our guiding principles? I'll pause for a moment here and let you just read very quickly, as opposed to me reading the slide to you. And then I'll emphasize a couple of these. I'll start with the top one. our concern is for people's safety. And there is no one step that we can take which will provide the only piece of safety that we need. It's not just PPE, it's not just cleaning, it's not just social distancing, all of the different things. What we're creating is a layers of safety, which then reduce risk in combination, synergistically, we hope, and we believe we've got the right pieces in place to reduce risk to a point where we're comfortable with proceeding with reopening the institution or restarting the institution. This is a teaching and research institution, and so we are focused on that and providing the best academic environment and product that we can for the students and our faculty and for the researchers. I'd like to make sure you see in the fourth bullet that this is an incredibly agile environment, is the best way I can describe it. One example is the state of New York has a list of states which are called restricted, meaning if you've been in those states in the last 14 days and you need to come back to New York, you would be required to quarantine. The list of those states changes weekly. So we are trying to adapt to a process that allows us to be agile in that environment. I'm going to skip down to the last one because I think that this is incredibly important for us as a university and as a community. From the beginning, before it was even really a part of what we were going to officially put into our plan, our constituents were talking about diversity, equity, and inclusion with everybody. Dr. Lisa Coleman, who is our Chief Diversity Officer and Senior Vice President for Global Inclusion, was a part of our discussions early on. Her staff has provided feedback and information, and we have chosen to weave issues of diversity, equity, inclusion, and belonging into our plans and not sort of set it off as a paragraph that we would put into our plan. Because this is our ethos. This is who we are at NYU. We believe we're a leader in this. And I wanted to make sure that you see that that's a part of what we've been trying to do. Next slide, please. When you have a situation that we have right now, we are trying to plan into an uncertain future. And that's a hard thing to do. So what we did is we started off by trying to figure out what we thought would be the most likely scenario starting in the fall, which is that cases would be lower and that we would be able to start with some sort of remote and in-person for the university. That has come to play. That's an assumption that we made that we started to use to plan. What we did based on that assumption is we broke the tasks out into work streams. And you can see across the university, there's a variety of work streams here that focus on subject matter, but they're all tied together. They work synergistically and across the board. We also have created a incident management team. This incident management team are the folks that gather what needs to be done and then execute that. So this level right here of the work streams is headed by senior folks in the university. So as an example, Dr. Chiatoli is the head of the public health. Operations is Executive Vice President Marty Dorff. For student affairs, it's Linda Mills. So these are very senior people who get together. We discuss the issues. We get expert advice from folks who are the lead players in that across the university. As an example, you're going to hear from Sabrina Ellis on all the HR issues. So that's across the board here for all of these. With that in mind, we would then figure out which decisions we need to make. The senior level of the institution makes a decision, and then they pass it to that incident management team that I mentioned that then executes the on the ground. How are we going to put signs in a building? What are we going to do about hand sanitizer? What's the, how are we going to quarantine? All of those specifics that we're going to do that. This has been in play since the beginning. Back in January, we started thinking about how we would structure this, and it has served us well. Slide. So where are we right now? If I could break it down into three things, it's on the left-hand side, wear a mask. You know, we are going to require masks in our buildings, and we're going to be trying to figure out how we're going to make sure that we can get that level of protective equipment distributed if we need to do that. So that's a core element of what we're going to do. The second is social distancing. We based all of our plans on the 6 feet separation between people, limiting large congregations of individuals, so that we can then continue to have activities. And that's driven class sizes, what we're going to do in the dorms, all of that. The middle one is me looking at my screen, I think, but really what it is it's working from home. It's continuing to work remote. So for the fall semester, one of the things that we're looking at is those of us as administrators who are working from home will likely continue to do so unless you are deemed essential for some on-campus activity. Slide. I mentioned layers of safety. Here are those layers, along with, and I'll add one at the end, which I think is going to be critical. But the idea is that no one of these is the answer. All of these contribute to the answer. The pictures you see on the right-hand side are actually NYU Shanghai. They have also used these. They were, at the end of their semester last year, they brought students back and used these layers of safety. And in doing so, had a very high success rate of people staying healthy. I would say that we had the same level of success at NYU Abu Dhabi during the spring semester, because they also had all of their students there, even though they were studying remote. And there were a few to no cases based on using these layers of safety. I add that the one that's not on here is behavior, and that's how people help each other in this. Next slide. So behavior. We are in this together, absolutely. And so keeping each other safe is our mantra. It's what we do for each other. So there are several campaigns that we're going to use that are going to help us to get the message out, but also to create this environment and this sort of culture around that says, I'm doing this for each other. So one of those cultural activities that we're going to do is we're going to have a campaign, and I really love this one, is I'm wearing my mask for, and then you would fill in the blank. So I'm going to give you who I'm wearing my mask for. I'm wearing my mask for my 91-year-old mother who is in a memory care unit in Southern California. So she's in a nursing home in a hotspot. So it's important to me that the people around her are doing their very best to stay safe. So if I expect that from people around her, I should expect that of my own behavior. So that's an idea about how we can personalize this so that it is our culture and it is our community that is working together. Next slide, please. So I have gone to my time limit, and I think what we'll do now is we'll switch over to Dr. Chiatoli, who will talk about public health, and I'm sure that there will be questions. So thank you very much. And if you, one last plug is, if you do have questions after this, certainly submit them. We can figure out how to get you the answer. But if you haven't gone to the NYU Returns website yet, you just Google NYU Returns. It's the first thing that comes up. And you can spend the rest of your day exploring the end of the internet on all of the information that we are providing about this. So I encourage you to go look there as well. Thank you.
Great. Good morning, everyone. Thank you for the opportunity to come on and talk a little bit and answer questions. And thanks, Jack, for the first part of the presentation. So I want to go over some of the major public health interventions that compromise our various layers of safety, as Jack alluded to. You saw on the previous slide the communications campaign that the university is going to undertake, really to promote what we know are those behaviors that are public health best practices. And if we think back to the spring in March, April, when New York was the epicenter of the pandemic, what got us to where we are today, one of a very few number of states that have low prevalence of disease, low transmission rates, that have stayed low, it really were these 4 or 5 interventions that we largely have full control over that got us there. And that includes wearing masks almost universally, which will be policy going forward here at the university from now into the fall semester. It is the physical distancing, that maintenance of 6 feet of separation wherever possible to limit spread. It is staying home if you're sick so that you don't spread whatever illness you have. It's the hand washing. It's the avoidance of large gatherings so that if there is anyone who's sick, you're not spreading it to a large number of people. And frankly, you're less likely to, because with fewer people, it is easier to distance. And again, those are largely behaviors and interventions we have control over. To facilitate social distancing, a whole host of things have been implemented. And I think, one of the things that was really a Herculean task was to set up the classrooms in a way that we could reduce the number of students per class that allowed for that 6-foot separation between students and faculty, set up office spaces, again, that will allow for distancing, including in the encouragement of continued remote work into the fall semester. The assessment of ingress and egress out of buildings, so we don't have people coming in and out in crowds, with signage, again, to facilitate some of the distancing. We have implemented already for the last several months a daily screener, which asks about symptoms of COVID, which asks about contact with anyone who might have had a confirmed or presumptive case of COVID-19. We ask if you yourself were recently diagnosed with COVID, and have you complete that screener either on the web, or most people are doing it on their phones through the NYU mobile app before they come to work. We have you take your temperature as well. And depending on your responses, you will either get a clearance to come in, a green, you may proceed, or a red, you should not proceed, stay home. And a member of our COVID-19 prevention and response team reaches out to assess and make a determination of what next steps might be. A lot of questions around testing, and we'll briefly mention some of the details because most of it was in the communication that went out to everyone. We are requiring everyone in the community, faculty, students, staff, to be tested at least once upon entry. And for staff who are working, if you've been working because you were considered part of that group who were working throughout the summer, or you've been given permission by your department to come before the 15th, everyone in that group needs to be tested before August 15th. And then submit your results through a discrete link so that we have a record of that. For those of you coming later in the semester, or later in the summer or into the semester, we ask that you get tested no more than 14 days prior to your anticipated first day back. We have several options for testing, including NYU Langone. Again, the information about how to access that is in the communication. There are multiple other places to go to be tested. One thing that we're trying to do is, with that multitude of options, some of them do have significantly delayed turnaround time. So we're trying to preferentially direct people, if you, for whatever reason, can't or don't want to go to Langone, you want to use another option, we're going to try to highlight the ones where the turnaround times are shorter to facilitate you getting your testing done in the time frame that is being requested. Obviously, if we identify anyone who is positive, the first step is to ensure that that person isolates, stays home under full isolation protocols. And then the COVID-19 prevention and response team would initiate contact tracing. That is to find out who this person has engaged with within the community, the NYU community who might be considered a quote unquote close contact, and then that person would have to quarantine. Our contact tracing efforts will be coordinated with the city, who has their own NYC Trace program as well. Again, our contact tracing efforts will be focused on the NYU community, but we know that we are in and of the city. So again, we would require the city's support and help for those cases where either the infected person is from outside of our community and we might not know, or someone in our community has had interaction with others outside of our community, and then we certainly want the city to know and follow up as well. Just one other mention of quarantine. As you know, New York State has a travel-related quarantine. I believe there are 34 states currently on the restricted list. So that is a state mandate. So if you have spent any time in the prior 14 days when you come back to New York in a restricted state, you are then asked to quarantine for a 14-day period. So that is fairly straightforward in terms of the state's quarantine requirement. We, like New York State, like New York City, will track metrics. We certainly will track the state and city metrics, but we will have our own metrics, which will include how many cases we have on campus, what our test positivity rate is, how many isolation spaces we have in our residence halls, among those metrics that we'll track throughout the semester that will help guide, do we need to be more restrictive with our activities if case counts go up? Can we relax restrictions if case counts are low and remain low? And then finally, for our students, thinking about how we deliver services, acknowledging that some of our students won't physically be here on campus and will be taking classes remotely from home and supporting them, but also thinking about our in-person service delivery and ensuring that it is safe for our students, for our own health center staff, and for everyone else in the community. And that will entail a large amount of telehealth and remote visits as well, so that we can assess our students before they come into our health center, potentially ill with any infection. So that is a quick overview of some of the public health interventions, which I hope at least answered some of the questions I think that had gotten submitted earlier.
Thank you so much, Jack and Carlo, for the overview and the presentation. We are going to move on to the questions that were submitted in advance. So the first question, following up on Carlo's presentation about testing, when will we receive email with instructions to make the appointments at Langone for testing? And will family members also be able to be tested through Langone?
So our understanding from Langone is hopefully, today's Friday, correct? Yes. Early next week, you should be receiving a communication from Langone that will walk you through the process of downloading their app and how to actually go in and make an appointment. So that should be coming early next week. It is, the access to Langone's testing through this mechanism is restricted to the staff member themselves and not family. But again, several of those other resources that we have outside of Langone, people can go out and get their family members tested as well. Generally, commercial insurance will cover that, but the Langone process is only for staff.
Thank you, Carlo. The next question is, what should staff do if they are being asked to return to work before they're able to get their test results? For example, a staff member asked to return next week, can they go and get tested today, but may not have their results for up to 2 weeks if they went to a different site?
Right, so we are trying to facilitate people going to sites where we know we're getting quicker turnaround time. And then there does need to be a conversation with the supervisor that although they're being asked to go, we are trying to hold a fairly hard line that you really should not come back until you have your negative test result. And Jack, I don't know if you want to share we are tying the test result or the tests to access to the buildings at some point. So at some point, if you haven't done your test or gotten your result and uploaded it, you actually won't be able to get into the building. So after August 15th, correct, Jack?
Correct.
You will not have access to buildings if your test result is not back, negative, and uploaded.
Great.
That's correct.
And is the testing protocol the same for faculty and staff? And can you address the concerns over how faculty and students are able to choose what is the safest for them while administrators and staff are not being given the same consideration?
So I don't know if there's a distinction between faculty and staff. The protocols for testing are identical with access to the same resources. So if there's some confusion about that, we can clarify it. But both the protocols and access to testing are identical for faculty and staff. The student protocols are slightly different because we know, one, we have students in our residence, two, we have students coming from a variety of places. So the testing protocols for students are slightly different, but really rooted in the same public health principles. But certainly for faculty and staff, they are identical protocols and resources available for testing.
Thank you. Can you talk a little bit about the responsibility of schools, department, program administrators in assisting with contact tracing?
So the contact tracing will, as I said earlier, largely be the responsibility of our COVID-19 prevention and response team. There may be occasions where we need to reach out either to the supervisor in a unit or HR for additional supplemental information about perhaps who was, at work on a particular day. But the actual contact tracing itself would be largely handled by the COVID-19 prevention and response team. I will just say that the HIPAA privacy laws all apply. So we have to be very careful about what we share, what we ask for of departments and schools.
Will PPE be provided, and how do offices acquire the correct items?
That's yeah, that's for me. So we've somewhere around 400,000 disposable masks, as an example. And over the spring and summer, you have been able to go to 561 LaGuardia or to 6 Metro Tech and get your mask if you needed it. As we begin the academic year, we're going to expand those sites to a few more in Brooklyn and in Manhattan so that there's access to those. We also are working directly with schools to figure out if there's particular cases where they're going to need them in a particular area. So as we get more people coming back to campus, we're going to expand the access to the PPE.
Thank you.
The sites.
Great. Have HVAC systems been updated to filter COVID, and how will we know about the safety of the air inside individual offices?
This is Jack again. So this is a very common question that we get. I can tell you that there's been a series of steps that have been taken over the spring and summer by our facilities construction management division that have looked at the air quality and the airflow inside the buildings. They've made repairs to anything that they thought was a system that needed repairs. They've changed out all the filters. They've increased, and I am not an HVAC repair technician. I apologize for the specifics here, but they've changed out how the air flows so that there's greater airflow. This is all in conjunction with best practices that are being offered by those particular sort of expert groups that talk about HVAC systems, to include changing filters where needed. So we've taken a number of steps to improve the systems. Thank you.
Thank you. So I'm going to try to balance in terms of the questions that were sent in advance and those that are popping up in the Q&A. So there was a question specifically for Carlo in regards to will NYU offer the flu shot for staff this fall as they've done in the past?
So while certainly the flu vaccine won't protect against COVID, it is an absolutely critical part of our overall intervention strategy. And while I'm responsible for the student piece, we have had conversations with those on the HR side responsible for the flu vaccine program there. And I think we will encourage and offer flu vaccine both for faculty and staff and for students. And I think try to be somewhat aggressive about encouraging and making it easy to get your flu vaccine this season.
Great. And then this question is for Grace and Sabrina. We've gotten some questions in regards to staff being anxious about returning to work. And maybe if you could talk a little bit about mental health resources and support and coping mechanisms for people that are anxious about the thought of returning.
Sure. Yes, we have been offering a series of courses through our iLearn, and our learning team has been offering those. They're really more platforms to allow people to share out on concerns that they may have, and then those in turn inform us as we go about developing our protocols for having staff return. Grace, do you want to, I was going to add another point, but do you want to jump in on that?
Yeah, sure. I'm happy to say that, I started out, when you introduced us, just saying that, we've been listening to the great concerns that people have, and we share your concerns, and we're really trying to think about ways that we can provide support. So we do understand that there is anxiety out there. What we've done is we've provided a number of different sort of support systems. So we do have support groups that we've created, and we'll continue to think about ways that we can create support groups. I do want to encourage you to think about ways of creating just community groups, connection groups within your own departments that really just address the connection to others. I think that helps to alleviate a lot of stress and anxiety and share even some concerns. But you can go to the Work Life website and you can take a look at the support groups that we're currently offering, and certainly reach out to us if you think there are others that you perhaps feel that there's a need for.
And I just would add to that I have been getting emails, and members of the HR leadership team have received emails from members of the community who have asked really good questions. Some of the concerns that folks have been echoed by other members of the community. And so when we get those questions in, we try as much as possible to work with public affairs to list those as a part of the FAQ so that we can document the answer, and so folks will know they're not the only ones that have raised that concern, and that we also have worked on the issue. The question that Jack asked previously about ventilation is something that has come up many, many times, and so it does help us. So thank you to everyone who has sent in those questions. Please don't hesitate. I know that there are a lot of questions that are coming up on the chat through the Q&A. So it does help us to get and convene to get answers to those so that we can put them out to the community and help to inform as much as we can, and also help to alleviate anxiety, as Grace said, for those who are returning.
Thank you. So we have another question about testing for Carlo. So if someone has an early positive test result for COVID antibodies, do they still need to get tested for the presence of the virus before returning to campus, or does proof of antibodies test suffice that?
So we are requiring that people have a viral PCR test. So unfortunately, the antibody testing is not an acceptable form of testing. And that's largely based off the fact that there's no definitive evidence yet of how long that antibody protection lasts for. And again, aligning ourselves with the state guidance, they're specifically asking for viral PCR testing. So as you said, evidence of the virus at the time of testing.
Thank you. There's a question in regards to safety measures. Will there be window guards or any kind of protection for staff members around their desk for those who are in front office locations?
This is Jack. So I believe the question has to deal with what we're referring to as plexiglass. So the question about plexiglass has been addressed in a variety of different conversations. As we have looked at the return to work plans. So you should all know that each of the units and schools submitted a return to work plan that was reviewed. It has details about who is expected to come back and in what sort of numbers. But one of the things that we're concerned about is making sure that we continue to keep the density in the buildings low, the number of people in the buildings low. So that's based on the direction that you're going to get from your supervisors and from the leaders of your particular school or unit as to when you're going to come back. If you are going to, you may continue to work remote based on your particular role. But one of the things is plexiglass. And so where do we put plexiglass up? Well, the primary place that we're putting plexiglass up is in those places that are forward facing to customers. So people who are coming in for something, and that's the primary place. We are not putting plexiglass up in between desks, as an example, because you're going to have social distancing. You're going to be de-densified to a point where you are far enough away in your environment that you don't need the plexiglass. There's a variety of reasons why we chose to do this. I'll give you two to begin with. The first is there are some fire codes that would be violated if we just put plexiglass throughout buildings. That's the first thing. The second thing is just the sheer amount of plexiglass that we would need to create to put it in between every desk makes it something that's unachievable, quite frankly. So we focused on the medical evidence that we have, which comes from the CDC and comes from best practices in other organizations, and chose this front-facing customer area. So, you know, as somebody walks into an office or a building.
Thank you. What will the role of faculty and staff be to address students that refuse to wear a mask in campus buildings? So maybe Sabrina could speak a little bit to that.
Sure. So there was a communication that went out to the community when we communicated about the testing and quarantine requirements. And the section of the email deals with compliance with safety and health rules. We're really going to have to rely on community enforcement for this, but it really comes down to norm setting. So we've communicated our protocols in that a mask is a face covering is required when on university buildings. But there are a number of ways, additional ways that we can ensure enforcement. Which one is, if you see someone who's not complying, you know, gently and peacefully urge them to wear their mask. If they're part of the NYU community, if they're in an NYU building, and they're not wearing their mask. The other options that are available is reporting it to the COVID compliance at nyu.edu email. You can also report it to the Office of Student Conduct, to the Dean of Students, to the department chair, or to Human Resources. And we have a process whereby we will contact those members if we have their name and contact information to remind them of the protocol. Certainly, we will need everyone to be compliant, and we will have to take very seriously any instances of non-compliance. So again, that will involve the Office of Student Conduct, and it'll also involve Matt Driscoll and his team. We also have folks who are monitoring the COVID compliance email and responding very quickly to any concerns. We have gotten concerns and we're responding to them very quickly so that we can ensure that members of the community are doing their part in making sure that we prevent any spread of COVID as much as possible.
Thank you so much, Sabrina. We're going to keep going with some of the HR related kinds of questions. So will staff be able to propose continuing to work remotely until a vaccine is available?
So yes, staff can propose working remotely. Just a thought about remote work is that we have asked our schools and units to be very cautious and conservative in returning folks, which is really in line with the guidelines that we've gotten from the state of New York, as many of you know and have seen. So already we will have much reduced staffing and presence on campus. However, given that we are going to be open, we do have roles that will require some staff to be on site, and that will be a unit by unit and a school by school consideration. We have a process that's been identified if there are individuals who are high risk or who have other circumstances that they would like to make us aware of in requesting modifications. And so we've laid that out. For any staff who've been asked to return, they should have received a return to work notification that gives them instructions on what they can do to make us aware of those circumstances. But to answer the question more directly, the absence of a vaccine will not be a basis for staff not returning to work.
Thank
if
you.
If they've been asked to do so.
Thank you. So how can someone request accommodation if they need one?
Yes, so if it's a health-related accommodation, they can reach out to the Office of Equal Opportunity. They are ready and have been accepting requests for modifications that are health-related for the employee. Other requests for modification should be sent to the employee's local HR officer, and that person in turn will work within their school or unit to explore the type of modification that has been requested and to determine whether the modification can be granted or whether a different modification might be considered.
Great. More questions for you, Sabrina. What are the options for essential employees who are afraid to return in person?
Yes, good question. We have had quite a number of essential employees who have been working since the start of COVID. And I just want to say to all of our essential employees that we're very thankful. We very much appreciate your effort. If there are other folks who have not been reporting up until this point, which there may be, I'm not aware of any, but there may be some essential. It's important that we clarify what the definition of essential is. So generally, essential means that in an emergency whereby we close campus buildings, those employees still must report to work. For those folks who will be asked to return as of August 15th, due to our reopening buildings, those employees are not essential. So I just want to be clear on what the distinctions are between essential and non-essential. But if there are any employees, essential or not, that have a basis for requesting a modification, they would go through the process that I just outlined, which is contacting OEO for a health-related accommodation. And for any other kind of modification, they would reach out to their HR person.
Thank you. Are there any accommodations or flexibility of hours being given to administrators who will have to take public transit in order to return to work?
In many instances, yes. So schools and units are working through that. And I have to say thank you to all of our deans and their senior teams, because they have been extremely thoughtful in trying to assign shifts for those employees who are returning to accommodate as much as possible so that they are avoiding congregant settings or settings where there's more people at certain times of day. So, but yes, various schedules are encouraged, different schedules are encouraged by us. And employees certainly can make their HR or their manager aware of concerns or preferences that they may have so that those can be reviewed and considered and responded to.
Great. Will it be possible to use WageWorks or similar programs as alternative forms of transportation, such as car service, bike share, since commuting by public transportation could expose staff members to higher possibility of infection?
Yes, so thank you for asking this question. So WageWorks is available for use for public transportation. Bike share, as an example, is not eligible for the WageWorks program. Also, and I want to thank Trish Holly, who's our AVP for Global Benefits, in helping to get more clarity on this. But Uber and Lyft can ordinarily qualify as an eligible expense under the category of van pooling if you are choosing that option. But apparently, due to COVID, both Uber and Lyft have taken this option off of their sites for obvious reasons. Few to no riders likely want to be in a carpooling situation when they're calling Uber or Lyft. So because of that, this option is not available for use in the WageWorks program. I would encourage those who have WageWorks to refer to the WageWorks website because all of this information is listed there, and they're making updates very rapidly as things change as it relates to public transportation or other forms of transportation that folks may rely upon. So I would just recommend that folks check their site for those updates.
Great. One more for you, Sabrina. In what ways is NYU going to support working family members who are seeking childcare, adult care, or tutoring support? That may be Sabrina or Grace.
So we have had quite a number of employees, and actually, as we've continued to be all working, there have been a number of things that we've all, I think, had to work through. There have been a number of challenges that we've had to work through, and the university has continued to offer the benefits that it has offered in the past. We recognize that for those people who will be on site, that they will have an added burden in, and I'm thinking particularly of those who are essential. I'm thinking of faculty members who will be teaching on site. I'm thinking of staff who will be coming on site. So they will have an added burden. We also have many folks who will be working remotely, and Grace Protos and I will be working with the provost office and also with Marty Dorp, the executive vice president, to determine which options will help balance the needs of both groups.
And Delmy, if I could just add to that, at Work Life, we had a list, or currently still have a list, of summer activities that we offered to parents. That is going to be updated to have educational and learning resources for the fall. And we're also actively trying to think about ways that we can help families connect to one another. Families have expressed an interest in connecting with other families so they can create family pods for childcare, for learning opportunities. And so we're looking at different ways to support that, and also to provide virtual and or in-person sitting or virtual tutors, and trying to sort of bring some of those services and support systems in place so that people can really rely on some of those, since the fall is going to be very different with childcare and with schools not being full-time. The other thing I want to say is our Work Life consultations are still available. So if you want to make an appointment, you can do that and talk to somebody about what your current needs are. We have a subject matter expert who's very tapped into the schools and the childcare centers and understands the resources. And also, if you want to have a better understanding of how your school should be considering other models, our Work Life consultant expert will be able to sort of share some of the things that they're hearing in terms of best practices.
Thank you, Grace. And there's one more question, Grace, for you. Are there any support groups for staff administrators? And if not, do you have any plans on creating?
Yeah, thank you. And a lot of people have been asking this question. We do have a number of support groups right now. We have support groups for new parents. We have support groups for parents of special needs children. We have a very active adult caregiving support group. We have a support group for adoptive parents, and we've been approached to create other types of support groups. So again, if you have an idea and you think there's a need, please reach out to us.
Great. So we have some questions that have come in the chat. So I'm going to go to the chat for a couple of those. Some units are organizing grab-and-go opportunities to retrieve tech equipment and files. Would this be scaled up to more school units with oversight to ensure density concerns are addressed?
This is Jack. Yeah, this is Jack. And I appreciate the question, Mike. the process is going to be with the units and schools to figure out when folks can come back. So the supervisors should and will be monitoring who's coming in on a particular day to do what they need to do. So it will be best managed at the local level with the intent of keeping the de-densification process going so that we don't have too many people in at one time, but the supervisors should be able to work through that.
Thank you. Grace, I have one more question that's very specific that I think a lot of people are wanting to know. How will the parents with younger children be supported as and New York City schools will have the kids be at home 3 or 4 days a week?
So, you know, a number of these support pieces that I talked about in the last question will apply to that. So whether it's online tutoring or facilitation of academic work, babysitting, we want to find a way to have families connect with babysitters and or pods, other pod families. And that'll be one way that we're going to be able to support. I think part of what we're hearing is that families have different variety of different needs, not just for kids, obviously for adults as well. And so we're trying to think about having sort of an array of options that will be able to support some of these needs. And we realize it's just going to be very complicated with the school situation. The other thing I will say is we have been talking to manager groups. We've been asked to come and share with managers, just, you know, an opportunity to share with them about how they can incorporate some workplace flexibility or some flexibility in planning the work of their office, and of course, understanding the needs of their teams.
We want to acknowledge there are a lot of questions about commuting. So NYU has put together some tips for commuting. I believe the link for that will be shared on the chat. We are close to the end, so we're going to try to maybe go for one more question. Is it possible to expand the NYU shuttle transportation to more locations, including Brooklyn? And in those locations, can bicycle parking be expanded?
I'll take that. This is Jack. So when we look at the transportation, the shuttles will be running. Our buses will be running. We will have to limit the number of passengers at to some scale. We're trying to determine with MTA what that sort of looks like, how they do it as well for best practices to make sure that we keep people safe when we do that. Additionally, we're putting up more bike racks so that people who do want to use a bike can use their bike to get to the campus. I wanted to emphasize that Delmy did mention about on the website, there is a specific place about commuting. And what I would offer is that it also has links to probably those methods that you use for commuting. And you can go to their websites also and get information directly from them about their recommendations on safe commuting as well.
Thank you so much. I want to thank our presenters. I'm going to ask, as we are low on time, if you have any final thoughts that are coming to mind or things that maybe we didn't touch upon. If we didn't get to all of your answers, we will look to answer your questions later on as well. So Sabrina, if you could get us started maybe in terms of final thoughts.
Yes, I've just been scrolling through the questions that have been asked. A lot of questions related to parents and what is happening with New York City schools. Grace and I are working to stay abreast, to get information on what's happening with New York City schools. I will say that we have parents who have kids in New York, New Jersey, and Connecticut, and quite a lot of the planning that's taking place with the K through 12 schools is very localized to certain counties, in some instances, certain cities. And there's been some autonomy extended at the local level on how various schools will plan for the fall. So we're trying to stay abreast of this, and we will definitely be back in touch as we learn more. We're obviously very concerned about it also. And we will be back in touch through our public affairs office and messages to the community on ways that we will try to provide additional support and information so that we can ensure that we can continue to be operative as a community, but taking into account the very real challenges and concerns that parents will be facing.
Yeah.
I want to thank everybody for taking the time to be on this today. These are all very challenging times. You've heard just a little bit today about what's been going on for the last 8 months. There's a lot of questions in the Q&A that we will try to address, either in sort of more mass communication that we do, or if there's specifics as you go through your leadership to get those questions asked. That's also another way to do that, so that you can, we can sort of funnel these, because we realize that there are community questions embedded sort of in what you're asking here. I would, again, highly recommend that you explore the website. There are multiple places there that you can then submit questions as well, and we can sort of work through those. So thank you very much for your time and for your continued work as we get ourselves ready for the fall.
Gina? I'm sorry. Grace, I'm sorry.
Well, I want to say thank you for submitting these questions. I've been going through them, and it gives us also continued sort of understanding of what the needs are. A lot of the concerns we've heard about, so I do appreciate seeing them again. I do want to encourage you to reach out to us for some of your work-life needs. I think the more we hear of the variety of needs, the better we'll be able to try to respond to support. So I encourage you to do that. And I do want to just go back to something that Jack said in the presentation, which was we're all in this together. And so we really do share your concerns, and we do have concerns of our own, and we are a community, and want to keep that first and foremost front and center. Thank you.
Carlo, did you want to add anything, or anyone else?
Just very briefly, again, thanks to everyone for all the support in getting everything done that needs to get done, and for really encouraging the keep each other safe philosophy and culture that we are going to have moving forward.
Matt, did you want to add anything?
Sure. Yeah, you can just see all the planning that's gone into this. I would just echo what Jack said. The website's the best resource for all this information. And I just also want to acknowledge the unions who have helped us in the planning and given us great input into making the plans better. So thank you to them. And thanks for having me today.
Great. So I just want to thank everyone who's joined. We know that this is an important conversation. And I also want to thank the organizers for these kinds of events, because I think they're really important in terms of our community. So I want to thank my colleagues for joining us today, and also you and everyone who was able to log on and participate, share your questions. This webinar will be posted on the NYU Return website so that anyone who missed it could view it at a later point. When you go to the NYU Returns website, I encourage you to take a moment to check out previous webinars that have already been posted. And please continue to check NYU Returns for the most up-to-date information about the fall 2020 semester. With that, I just want to say thank you once again. Stay safe, enjoy the rest of the summer. And I look forward to the day where we'll be seeing all of us, each other around campus. Thank you so much.